Murray McInerney from Croaky here at the end of day one at the Youth Day of the Victorian Mental Illness Awareness Council biennial meeting. And I have Jamie here who has played a big role through today. Could you introduce yourself or your many roles?
Yes, so my name is Jamie. I'm here working with VMIAC as part of the Youth Leadership Program. We've been a youth project officer putting together today's youth conference. I also work with Headspace and Origin doing some youth mental health advocacy. And I've come from a journalism and law background with some chronic health conditions, and I'm just sort of pushing it all together to make an interesting career out of it and speak about the experiences of people from all those backgrounds.
Well, it came together really well, actually, in two of those panel discussions that you facilitated and helped organise here. Can you talk about who you sort of brought together in those rooms and what you were trying to do?
Yeah, so I'm lucky enough in the few years that I've been working in the mental health field, I've been blessed to meet so many incredible people and sort of this opportunity to talk about youth mental health. I thought it would be amazing to draw on these people that I've worked with over the years and get them to speak about their experiences, because there's only so much I can say on myself, but there's so much going on in the communities and we need people with that lived experience to talk about that. And so I brought in people from cultural and linguistically diverse backgrounds. We had some LGBTQI representation. We had someone from a regional area. And then we had a diverse group of people who work in peer support and advocacy as well. So we brought together these groups of incredibly talented, amazing, passionate people to talk about what's really going on in youth mental health at the moment.
And what's your takeaway on what is and isn't?
Gosh, I think the biggest problem we have is making services inclusive for all young people. I think when we think about youth mental health, we're thinking about, like white, cisgendered, English-speaking people who maybe have a bit of anxiety about their uni exams or, maybe having some relationship difficulties. But we really need to talk about the breadth of these issues. There's so much complex illness going on that we don't talk about. There's so many barriers to accessing healthcare for minority communities like LGBTQI+, and cold communities, especially Aboriginal communities. I need to be frank, I wasn't able to get representation for Aboriginal mental health at these panels just because they're so left out of the space, which says it all. And so I think we really need to start talking about how do we make our mental health services inclusive for everyone, and that means language accessibility and LGBT education for staff so that people don't have to justify their existence when they go into these services, and making sure that when we deliver these services, it's for all young people, not just, like the rich white kids from out in Brighton.
Because that was a big issue, wasn't it? It's that people end up maybe finding specific services that can meet their needs, but they've already told their story on multiple occasions and met with no support.
Yeah.
What were the stories that popped out, some of the stories that popped out of today's panel discussions that struck you?
I think the best one that sort of encapsulates everything that brought us here today, this incredible person, B. They're so young, they're 19, and they've been navigating the mental health care system by themselves for years. They've moved to Melbourne to be able to get mental health care, and their experience not having family support, in mental health, we talk about family, but so many of us don't have family, or our mental health problems, and trauma is caused by family. And so B's experience, as an independent teenager finding their own mental health support, and then also as a queer or trans person having to navigate mental health support on top of transitioning. And, in an ideal world, we'd have psychiatrists who are also gender specialists so that a vulnerable young person who's just moved to a new city could see one specialist to address all of these issues. But as the system is at the moment, B's had to go to one place for treatment of the trauma, and then another for transitioning, and another service for something else. And it's just tiring, we need to study, we need to work, we need to take care of ourselves. And the fact that our services aren't equipped to support us through what is a really tough time in our life says it all. It's not built to support people the way that we need it, and we need it done now.
It's also built with many assumptions, and they said about family going to hospital. Can you talk to some of those, and if you remember that story?
I mean, I can speak on that myself. I've been sent to hospital a couple of times, and the first thing they want to do is call my mum and dad. And the reason that I'm going to hospital is because of trauma-based illness that's caused by my family. So inviting family in is the last thing I need. It's only going to aggravate the symptoms that I've come to hospital for. And I think we talk a lot in the queer community about chosen family. And so myself and this amazing speaker B, when we're in hospital, we want our family there, but our family are our queer siblings and our community. And the hospitals, they won't allow that. They don't recognize that friendship is family. And so when we need family support, we need our best friends in there, and the system isn't designed to allow that. So we're isolated and alone and terrified, and we can't get the family support that other people might take for granted.
When, as somebody working in the mental health system, and I'm going to get to the bit where we're in a big reform environment, but what do you see as the barriers to getting these issues on the agenda?
I think that as a whole, we have a really hard time talking about things that make us uncomfortable. If we want to address LGBT health and cultural and linguistically diverse health and Aboriginal health, we need to unpack some serious issues that we have as a society, like the sheer racism that still goes on and the homophobia and transphobia. We're only going to address these issues once we address the biases that we hold, and that means challenging the way that we think and challenging the way that we relate to people, and that's really hard work. And I understand that for a lot of people, they don't want to do that hard work, and so nothing is changing. But if we want to save lives, we have to have those conversations, and we need to do it now because people are dying every day because of it.
And what about service system barriers?
I mean, money, especially for young people and young people who don't have the luxury of living at home with two income earning parents. So many of us are told to go to private psychiatrists and services, but for myself, I've been financially independent since I was 15, 16, and I am working 6 part-time jobs to try and pay the rent. I am not in a position to go and purchase private health insurance for not if, but when I need that support. And so we need decent free healthcare, and we need it now. We can't afford to wait 6 months on a wait list. Like, if I'm suicidal today, I need help today. And a wait list is a terrifying barrier to healthcare, because when you see that you've got a wait list, it has this feeling of like, oh, I'm not worthy of help right now. I've got to wait. And that can aggravate the symptoms that are making your life difficult. And we need free healthcare, and we need it now.
And we're about to find out whether or not we are going to get reform in Victoria and beyond. Nationally, there's also the Productivity Commission, the Aged Care Royal Commission.
What's going on in the space?
Yeah, but particularly in Victoria, everyone's watching the Royal Commission, which is about to hand down its interim report on mental health. What are your hopes and worries?
I hope that we can create a more universal system that includes everyone, absolutely everyone. I think we also need to take away this weird space where youth services will go from 12 to 25, but when you get to 25, what do you do? I think at the moment the system assumes that when you get to 25, you've got your full-time career ready to go, and you've got the money ready to get your private health insurance, and you'll be right, mental health sorted. It's not like that, and for a lot of young people with mental illness, our youth has been spent trying to survive, that we don't have degrees and we don't have the experience to go and get the work that we need to pay for private insurance. So we need to take away this weird fascination with this 25-year cutoff, and we need to have it, from childhood through to senior. We need to have good healthcare for everyone, and it needs to be accessible and inclusive. I think there's a lot of problems, and I'm not entirely sure that the Commission's going to be able to resolve all of that, because it's beyond the system. It's a social thing, and that's really where we need to get.
Yeah, and that takes us to Canberra and beyond too, doesn't it?
Yeah, but I think it's a grassroots level as well. It's having conversations with your neighbour about maybe you shouldn't be racist, or saying to your homophobic brother, hey, let's not say those things. Because once we start to unpack these issues at a grassroots level, it goes back up and it feeds back into society, and that makes it easier to change things top down and bottom up. It needs to be every way possible.
Well, let's hope that the Royal Commission has a tiny bit of that.
I'm hoping and praying.
Absolutely. Thank you so much, Jamie.